Clinical Pearls, brought to you by Medicom Oncology.
Hi, I am Dr. Carol Ann Huff. Over the next few minutes, I will discuss with you how I dose bortezomib and dexamethasone in conjunction with daratumumab in patients with multiple myeloma. This regimen has been found to be superior to the administration of bortezomib and dexamethasone alone, which was published in the CASTOR trial in the fall of 2016 in the New England Journal of Medicine by Palumbo and colleagues. In the labeled indication for bortezomib and dexamethasone in conjunction with daratumumab, bortezomib is dosed on the traditional day 1, 4, 8, and 11 every 21-day schedule at a dose of 1.3 milligrams per meter squared. I, however, administer the bortezomib at a slightly higher dose of 1.6 milligrams per meter squared subcutaneously days 1 and 8 every 21 days. The reason for this difference is the data in other trials has shown that there has been similar efficacy with a lower incidence of peripheral neuropathy. Many of these patients already have peripheral neuropathy from prior administration of anti-myeloma therapies, which might also include bortezomib, and I have found that this has been equally efficacious with less risk of toxicity. The first 3 doses of this combination therapy are given on an every 3-week schedule, with daratumumab being given at the standard dose of 16 milligrams per kilogram once a week for 9 weeks continuously, or 3 full 3-week cycles, followed by cycles 4 through 8 being every 3 weeks, with the daratumumab being given once on day 1 of each of those cycles. The bortezomib is given weekly for days 1 and 8 out of every 21 days for the 8 cycles of therapy. From cycles 9 and beyond, it is daratumumab given once every 4 weeks, again at the dose of 16 milligrams per kilogram, as published in the CASTOR trial. The bortezomib is discontinued after cycle 8. Dexamethasone is given at a dose of 20 to 40 milligrams orally on days 1, 8 of the 3-week cycle for the first 8 cycles of treatment. In addition to the premedications that are indicated in the package insert for daratumumab, which are methylprednisolone, acetaminophen, and an antihistamine, we have found that it has been helpful to add in montelukast, 10 milligrams orally on the days of infusion of daratumumab for the first 2 to 3 cycles to help reduce the incidence of infusion-related reactions, allowing the ease of administration of the daratumumab. This 3-agent combination has been found to be highly effective in patients with relapsed multiple myeloma and can be readily administered in an outpatient setting to the majority of patients.
Don't forget to subscribe to the Medicom Oncology podcast channel for more clinical pearls. And be sure to visit managingmyeloma.com for more practice resources.